he has spinal stenosis in the lower 3 levels, here, here, and there. Okay.
Okay.
Spinal stenosis is a condition where the space inside the spinal canal becomes relatively narrower compared to what he was several years ago. Okay. So it's like having too many people to live in a small room. Previously, say supposedly one person was living in that room. Now there are like 6 people living in that room. So either the room has shrunken in size, or there are too many people, too many structures in that. In any way, there is less wiggle room inside that space. That's basically spinal stenosis is. It could be due to arthritis, or certain areas, certain pedicle structures should be small, so they get smaller space inside the spine.
Okay.
That's in essence spinal stenosis is. The discs in this part has degenerated. That means it's not the disc that belongs to a 16-year-old person. It has lost its water content. It is beginning to shrink.
Okay.
And that is pretty normal in old age. Okay. And also it depends on the wear and tear effect on the disc. He also has some stenosis of this hole through which, this is not exactly the place, but I'm showing you for your camera.
Okay, thank you.
The hole through which the nerve comes out.
Yes.
And that hole is also becoming smaller in diameter. Okay. So that could also give rise to pain. And on top of that, he has some arthritis in this sacroiliac joint.
Okay.
Which is not that important at this stage. And has what we call spondylosis. Those are stress and strain on these part of the joints. These are called facet joints. Over here, over here. Okay.
Okay.
This is in a nutshell what he has in his spine.
Okay.
Okay. The treatment is what we have already given him. Then walk slowly. Don't get into too many things. Don't torque your back too much. Less turning, twisting, and bending of the back. And walk slowly. If you do that, probably you can save from surgery and keep going. Okay. In other words, if you can control the arthritis part of it, do not provoke any irritation in the spine, less chances of irritation and pain.
And what about the shots? What are the injections?
The injections are the one I gave you last time.
Was on the right side.
On your right side. Did that help your pain on the right side?
It's less than it has been, but
okay. It is what I wanted to hear is that it's a good thing. It is less than it was. The day I gave you the treatment, did you get a good relief on that side?
Yes, but I did almost nothing. I mean, I just relaxed.
That's fine. How many days it lasted?
Probably 4 or 5.
4 or 5 days. So the 4 to 5 days, was it good relief?
I thought it was.
We're talking about just that right side.
Yeah.
Okay.
Yeah, it was definitely better.
Okay. So like 80% relief?
Yeah, pretty near.
Pretty near. So that is a good result. And that's pretty much goes with all the situations we talked about right now. The diagnosis. Now, it's only a diagnostic test. I'm just testing the possibility that your pain is coming from these areas. Okay? And the possibility is somewhat correct in you telling me the answer that it helped you 4 days. So what I will do again, the usual Medicare requirements are, it's not even mine. Requirements are we have to go and do that again on that side, see whether the results that you got is reproducible, and if he does get that kind of result, then we will go and do the real procedure called radio frequency ablation, in which we will put a probe here, and here, and cauterize those nerve endings that supplies this region, which will help to decrease the pain over there.
So basically you're going to kill the nerves so that they don't feel pain.
Yes, it's a reversible killing, not killing permanently.
Okay, not permanent.
Based on the studies so far, not. I don't know, 5 years from now it is going to change. So when the nerve is reversibly killed, he won't have the pain at that time. But when the nerve terminals begin to regenerate, he is going to get the pain back. But usually, if he behaves himself in terms of walking, standing, sitting, turning, talking, etc., he is going to get good relief for 3 months to 1 year. That's the advantage, and it is a
From
pretty
the more permanent process, not the injection is a trial.
Yes, it's
Okay.
a diagnostic nerve block, just by the name itself.
Okay.
You're trying to see.
Let
The
me ask
MRI is going to tell you only the physical abnormalities.
Okay.
Okay, we'll tell you the car doesn't have a wheel on the left rear end.
Okay.
But whether the car can run or not, it's not going to tell you.
Okay.
So we need the dynamic processes that we do, try to figure out where the pain is coming from.
Okay.
Okay.
The injection that that he's taken, his appetite has really slacked off. Are there any side effects to that drug that could?
The steroid that we use is a very tiny, small amount.
Mm-hmm.
You may have got approximately 20 milligrams of Kenalog, which is a tiny dose. If you go to the emergency room with pain, when they give a IM shot, they usually put 120 milligrams. So this is a very tiny dose. In spite of that, sometimes you could have some alteration in the appetite.
Okay.
Usually people get more appetite.
Huh.
Steroids make you
my hands.
steroids make you eat more and you gain weight. That's how usually
Okay.
that you will find. But in this case, it has a reverse effect. But it is all these procedures are very commonly done procedures, and the side effects on the body are very minimal,
Okay.
if at all none.
Well, just last night I was saying to my mom, because my mom's concerned about his appetite, just eating a little bit. And now last night was not the norm. He ate a very good meal, but
Okay.
my mom's been real concerned because his appetite has been so little. And I said, could it have been this drug could it have made him, could that play into it?
It can be, yes.
Well, this head
And
and
the
I
other
know
thing is,
he's using it as
the
weight control, but
the other thing is, he is taking prednisone, the steroids, on a daily basis anyhow.
okay, so I don't know
He's
that.
on prednisone 2.5 milligrams every day, started by his medical doctor.
Okay,
So-
and that would cause,
Yeah, this is the same thing
Yeah.
I'm giving. I'm giving it at the target site. So, what you need to do is you need to go back and sit with your medical doctor and try to figure out. He is 87 years old. He may have so many other reasons why he is having lack of appetite. He needs to have his colon, stomach, everything changed to see if there is any problem going on. See if he has any cancer inside. All those things needs to be checked. I'm only dealing with
Right.
just the spine related pain. Okay, so all those things are important to be checked.
Yeah, I've got a physical schedule for next week, so Mara Diego is gonna give me
Yeah.
a physical. And really, I think Mama's overreacting to my diet.
But to answer your question, steroids can make some changes in the appetite profile.
okay,
Okay. So what I will do is I will stop here. I don't want the other patients to wait too long. I'll see you in 2 weeks. Then we will start doing the procedures on your back. I'll make a
Are you saying
change.
the more permanent procedure, like, is he gonna
We
get
haven't
it?
reached the permanent procedure yet. I only give one test block on right side.
So when, are you gonna do another test block?
Not today. I think we have taken enough time, and I don't want other patients to wait too long. Today we will make it as a informative visit, explaining everything to you, and